Today we're going to talk about chapter 12 in your community health nursing book, which is on case management strategies. And we're talking about the role of the community health nurse. So we're going to dive into what is his role. It's the glue of the healthcare system, and that is the case manager. In 2026, we define case management as a collaborative, dynamic process. It's not just paperwork, it is a clinical specialty that assesses, plans, implements, and evaluates the options and services that are required to meet an individual's complex health needs. So think of it as whole person care. And according to the latest CMSA standards, the goal is to improve these outcomes and value, which means we aren't just looking at medical data, but we're looking at those social determinants of health. Are they housing secure? Like, do they own a home? Can they afford their meds? Case management is that bridge that connects all the dots to ensure there are safe care transitions. And looking at the standards and principles. So, how do we do it right? And we're following those CMSA standards of practice, which are significantly updated to include now including something called health equity. So, the core principles, we're looking at advocacy. This is the North Star. This is where we empower the client to self-determine their care. Then we have cultural responsiveness. Especially in 2026, case managers must use inclusive communication and address any implicit biases that could affect access to care. Evidence based practice, we're using data. And increasingly now, we're using AI driven predictive analytical data to identify high risk patients before they're even hitting our ERs. In the case management process, it's a cycle: assessment, planning, implementation, coordination, monitoring, evaluation. If one piece fails, the whole care plan can crumble. We're looking at ethical and legal landmines. So let's talk about all our heavy stuff, right? We're going to talk about ethics and law. In today's landscape, privacy is one of our biggest legal hurdles. With the 2024 HIPAA updates protecting, reproductive health data and protecting a lot of our mental health data, case managers must be incredibly diligent about how and when they share information. So ethically, we balance these four pillars: our autonomy, respecting the client's right to say no to a treatment, even if we think that it's best for them. We have non malfeasance, beneficence, doing good while actively avoiding harm, looking at justice, ensuring that resources are allocated fairly, and veracity, being 100% honest with the client about their options and limitations. One of the newest legal challenges we have now in 2026 involves AI accountability. If an algorithm suggests a care plan that ends up leading to a poor outcome, who's liable? The case manager still remains that human filter. You cannot delegate your ethical judgment to a machine. So, case management and the healthcare reform. So, how does this all fit in the bigger picture of healthcare reform? So, in 2026, we're seeing some of the changes going on with the landscape of that one big, beautiful bill. It has restructured Medicaid, it has increased the focus on some rural health transformations. And the reform is actually moving away from like a fee for service and going more toward a value based care. It's like, yes, you saw the provider and the provider again gets paid, but what value did that provider give to the patient? So in this model, case managers, they're the MVPs, right? Because they save the system money by preventing hospital readmissions and managing chronic conditions like obesity, like diabetes, and they do it through very integrated pathways. So we're also seeing this big push for hospital at home initiatives. So case managers are now coordinating these high tech home monitoring systems that help keep patients in their homes rather than in hospital beds. So to wrap up, chapter 12. Case management is about navigating the intersection of clinical care, legal mandates, human empathy, and it's a very tough job, but it's the only way to ensure that no one falls through the cracks of a very evolving system.